In 1900 America, a baby girl had a life expectancy of 44 years. That same girl, born in 2000, has a life expectancy of 78 years. This is thanks in part to the many public health interventions that have improved the health of our communities. Interventions such as disinfection of water, vaccinations, and pasteurization of milk and juice have prolonged countless lives. More recently, the value of some of these interventions is being questioned, creating myths that are not always founded in fact and good scientific research. In 2012, the Summit County Public Health Department launched a series studying 12 of these myths to determine whether they are true, false, or in some cases need more research. In researching these topics, only reputable sources of information were used, such as government, because we're here to help, academia, and peer-reviewed publications. Join us in 2012 as we separate fact from fiction for 12 of the most common and debated public health interventions.
Wow, what a cute baby. What's your baby's name?
Thanks. His name's Johnny. We're going into the doctor tomorrow for his shots and his well-child check.
Oh, I didn't immunize my children.
Oh, really? Why not?
Well, I just think that children can fight off diseases and illnesses, and they don't really exist in this country anymore. And beside, my husband, as a child, never got vaccinated, so he's really healthy, and you can get some information online about the dangers of vaccines, so we just decided not to vaccinate our children.
Huh. Well, you bring up some really good points. I think I better take a look at the internet and check that out before we go in tomorrow.
Yeah.
Thanks.
Yeah.
Do you think vaccines are necessary?
Oh man, I don't know. Yes, I do, absolutely.
Depends.
Absolutely. Absolutely.
Not for everyone, no.
So it looks like Johnny needs his vaccinations today.
Well, yes, but I actually have some questions first. Could you tell me what exactly are vaccines and how do they work?
Well,
how vaccines work. Vaccines pack big protection into itty-bitty packages, and these guys mean business. Essentially, vaccines give your child's body a practice run in defending against real-world germs. There are 5 main ways that vaccines are made. Number 1, a live but weakened form of the disease is used. Number 2, an inactive form. Number 3, vaccines could use only part of a disease. Number 4, or just some deactivated disease toxins. And number 5, some vaccines use a much less dangerous wannabe version of a virus. But no matter how it was made, all vaccines have the same strategy. They initiate the creation of protective antibodies without actually making your child sick. These antibodies are kind of like the watchmen in your child's system. They're constantly on the lookout for any bad guys or diseases. So if and when they come across one, they sound the alarm for your child's body to go on the defense and attack the germ right away. In some cases, booster shots are then used as gentle reminders for your child's body to always stay on guard. The only other way to create protective antibodies is to actually get sick. But when your child becomes infected with a disease naturally, there's no telling its strength or how it will affect them. Vaccines are a safe, controlled way to build immunity. So in the future, if the real germ ever shows up, your child's body will recognize it and keep that shield of immunity up for his or her entire life. And when they're good, we're all good.
I'm a little nervous about vaccinating Johnny. I've spent some time on the internet reading about some dangers of vaccines, and I'm actually not very convinced that he needs them. It seems like we're not seeing a lot of these illnesses anymore, and I don't know that I actually need to vaccinate him for these diseases.
you know, vaccines are still important. There's a number of vaccine-preventable diseases like whooping cough that are still occurring in this country. And you know, with global travel becoming more and more popular, many of these diseases are really just a plane ride away.
Do you think we give children too many vaccinations in this country?
No, I don't. We've been able to eradicate certain kinds of infectious diseases because of vaccinations.
No, I think if they're spread out, that it's okay.
That's possible.
I would say no. I don't know the number is on how much we give children, but I grew up getting vaccines and it helped me out. I never got measles, mumps.
Well, it seems like there are so many vaccines today. I know I didn't get all of these when I was little.
You know, and I didn't get them all when I was younger either, but you and I were at risk for serious diseases such as pneumococcal and Hib meningitis. Today we're lucky that we can protect our kids from 14 serious diseases.
Well, how many shots does he need today?
Today he needs 4.
Wow, 4. That seems like a lot for his little body. Are you sure he can handle that?
Yes, his body can definitely handle 4 shots today. You know, if you think about it, every day infants are exposed to hundreds and thousands of new viruses and bacteria. Their immune systems have billions of cells ready to fight these off. And so to get 4 shots in one day really isn't a problem.
What do you think about an alternative vaccination schedule for children?
I think I'd probably have to see it and compare it to what is typically suggested and probably to try to decide from there.
I think it should be visited and looked at. I mean, I think we give kids too many pills and medicine anyways these days, so.
I'm not exactly sure what you mean by that.
What are the alternatives? I haven't heard of the alternative schedule.
Only if it's proven to work.
You know, I actually have lots of friends who have chosen to do a delayed schedule so their kids don't get too many shots at once. Is there any harm in doing that?
You know, the vaccine schedule that your doctor recommended has been specifically designed to protect infants when they're most at risk. And so any time that you delay a vaccine, you're leaving Johnny at risk for certain diseases. You know, not to mention that a lot of alternative schedules require extra visits to the doctor, which is an additional cost to your family. And in addition, it's more stressful situations for Johnny.
Do you think there's any truth in the idea that vaccinations cause autism?
Possibly. Depends on the vaccination, where it comes from, you know, what state, what country.
I don't. I mean, I think there's been plenty of studies showing that they do not.
I guess it would maybe depend on what vaccination, but I mean, I don't think so. I haven't heard anything up to this point.
I don't know, but the rise in autism, I don't know the correlation, but wow, yeah.
I don't know enough to say yes or no.
Well, I also read that autism can be caused by MMR. Is that true?
You know, autism is a burden for many families, and people want answers, and so do I. But there have been many well-designed and conducted studies that show that the MMR vaccine does not cause autism.
Huh. Well, are there any risks with the vaccine?
You know, vaccines, just like any other medicines, do have side effects sometimes. The majority of those are really minor, such as a low-grade fever or pain at the injection site. Any serious reactions are extremely rare, and clinic staff have been trained to deal with those. The benefit of getting vaccines far outweigh the risks for almost all children.
Okay, well, you know, I was really hesitant when I came in today, but I really thank you for the time you spent answering my questions today, and I think I'd rather do what's recommended for him and get him his shots today. It makes me feel better to protect him against the diseases that I can.
Good. I'm glad you made that choice. And you know, anytime you have questions about vaccines in the future, you can always call your doctor or your local public health agency. There's also a lot of really great resources on the internet. You just need to be careful that they're from a reputable source. If you'd like, I'm happy to provide you with a list of really great websites.
That would be great.
Good. So let's go ahead and do Johnny's shots.
Okay.